If you're looking for a book to help you with anxiety, then you cannot miss this month's book therapy pick. You really have to pick it up. Is Diana Garcia. I'm a licensed mental health counselor in Florida, owner of a private practice called Nurturing Minds Counseling. My monthly book therapy series is where I pick one mental health self-help book to review, recommend, and highlight at least 3 key insights. This month I'm doing something different, so actually stick to the end to wait to see what I'm doing. You really are not going to want to miss it. This therapy pick, it's The Anatomy of Anxiety, Understanding and Overcoming the Body's Fear Response by Dr. Ellen Vora. She's a psychiatrist, relatively recent book, as you can see. I saw this book a while ago, but I just haven't had the time to read it. I finally picked it up and I'm so glad that I did. I had so many good recommendations, and I'm going to get to at least 3 insights from the book, but really I could not do it justice in just 3 insights. So I really, if you struggle with anxiety, any type of anxiety, I really recommend that you pick up this book. Let's jump into the summary of the book. The book is broken down into 3 parts, as you can see from the screen. Part 1, the first couple of chapters, it's all about kind of really explaining anxiety. What is anxiety? How does it show up? How does it function? Part 2, it's all about false anxiety. So that's really digging deep a little bit into all the factors that could impact and make you have more false anxiety, which I'll explain in a second. Really, she has like a chapter on all these different factors and recommendations in each. Part 3, it's true anxiety, so learning how to tune into that and really kind of some factors that kind of play a role in true anxiety, as well as kind of, again, recommendations generally on what could be helpful. Insight number 1, I kind of already started to talk about it, but it's a difference between true anxiety and false anxiety. So true anxiety, she talks about, again, like I just mentioned, that's when your body is communicating an essential message about your life. Pretty much you should not be ignoring these messages. You should be tuning in and listening to what this type of anxiety is telling you, that what's kind of off kilter in your life. She talks about more so false anxiety in the first part of the book. That's more of when your body's communicating a message, it's sending a signal, but more so that something's off balance physiologically. So again, more so like maybe you don't have enough sleep, or maybe you're not providing yourself adequate nutrition, or maybe you're over caffeinated, things like that. So she talks a lot about that. Nowadays, a lot of people will get messages, right? So they'll have anxiety, they'll still have the same symptoms of anxiety, but they perceive it like when they think about it and say, oh my gosh, my heart's racing, or my mind's all over the place. And when they really slow down, it's more so a stress response to, again, some of these habits that they haven't been working on. So she really wants to help you distinguish a little bit between the two and minimize instances of false anxiety by starting to look at kind of changes in your life. And that's kind of the first part of the book. It's looking at like recommendations for sleep, nutrition, your gut, also recommendations like for females, if their hormones, their cycle, things like that. So that's why I'm saying I really can't do this book justice, because each chapter has just so many good nuggets of information. But again, just kind of discerning the difference. I did want to point out, because she does have this false anxiety inventory, and I thought that was pretty helpful, especially if you struggle with anxiety, kind of going through this list just to make sure. So if you start to feel anxious, kind of stopping and pausing yourself. Okay, I'm not sure why I'm anxious, but going down this list, am I hungry? Am I having a sugar crash, right? Under caffeinated, sluggish, dysregulated. So things like that to kind of help you maybe rule out some of the basics that a lot of us don't really do. Number 2, this one's a little bit more kind of brainy. It's more this cytokine hypothesis. So she talks a little bit about like the current perspective of mental health, and really more, I think, from a psychiatric perspective, is that there's certain kind of deficiencies in certain neurotransmitters, serotonin, dopamine, things like that. Hence why there's certain medications that start to boost those up, particularly serotonin. And so again, she's talking about like, yes, that's still valid. Obviously, practitioners are still following that model, but there's new research talking about this hypothesis. Ultimately, it's talking about the role that inflammation is playing in your body, and really starting to understand that there's more research that is coming out saying that really the more inflamed your body is, the more you're going to be having negative outcomes, including impacts to your mental health. Part of the reason it's, she kind of gives some hypothesis, or at least hypothesis in general, that from an evolutionary perspective, they believe that actually these responses that we have when we're inflamed have pretty much similar symptoms to anxiety and depression. Right. So again, these are just signaling. Back in the day, they were signaling to our ancestors that something they either needed to kind of balance something, or something was wrong physiologically. So she really talks about, again, and part of what backs up this theory is that these cytokines can really cross the blood-brain barrier, and it can directly impact the parts of our brain that activate fear and threat, right? Which is all part of the anxious response, right? Anxiety is when we're afraid, right? Something's going to happen, right? So that fight, flight, or freeze response has kicked in. So again, she goes in way more detail. I'm giving a super basic overview, but I really liked, and I wanted to explain that because now this is kind of, I keep hearing this kind of theory, this inflammation, and really starting to have a focus on that. And so she goes into more general recommendations, but just off the bat, some that I took away from that chapter and throughout was really starting to prioritize anti-inflammatory foods and staying away from inflammatory foods. And so again, she gets into more details of what that is, what that looks like. The second general recommendation is really starting to, again, focus on gut health. And if you're having issues with your gut, then like starting to focus on healing your gut health. I'm actually going to link here a link to my other book that I did, Book Therapy. Dr. Drew Ramsey's book that one of the insights was on gut health as well. Again, I think gut health is now something that's really coming out, the importance of it and impacting your mental health and just overall. So that's like kind of just a general recommendation from this part. The third one throughout the book, also focusing and prioritizing rest, sleep, relaxation. So again, she also talks about learning how to manage your stress better, close the stress cycle. Again, I'm going to link another video here, burnout, because I also have an insight there where I talk about the stress response and the stress cycle. Again, obviously, since all of these books are kind of really hitting on these key insights, these are things that I think when I keep seeing and I keep reading, then I know obviously this is something that is valid and it's having an impact. And then of course, when I see this showing up in my clinical work. Again, the last general recommendation from this, it's go get some sunshine, right? So she talks about the role of vitamin D, so insufficiency, deficiency that a lot of us have. And of course, you can supplement. And she also talks about that there's some research that shows that it's much better to actually go into the sun and get vitamin D that way. So if you can, really make that a priority in your life. Okay, insight number 3 is a little bit more from the third part of the book. So really tuning into true anxiety. Again, because we talked about part 2 is all about kind of ruling out, getting changes in your life to start to minimize the false anxiety. But the next part is all about then tuning into the true anxiety and how do you start to do that. So just, again, these are just general recommendations that I took from different parts. The first one is really more just get really curious. Again, like instead of seeing all of your anxiety as something that you need to avoid or suppress, and in general, that's not my perspective or approach when it comes to anxiety, whether it's true or false, but really like, again, once you've started to weed out like, okay, you're not hungry, you're sleepy, and you're making changes to your life. So to really minimize that, but man, you still have this nagging feeling either about your relationship or your job, right? Or your future, whatever the case is, something just feels off, right? So get really curious. And then this kind of goes to the next part of like really starting to cultivate being still and just having more of those moments, whatever type of mindfulness practice you want to do to encourage that. But again, you can only start to listen or tune into this true anxiety if you're still enough to actually kind of hear what it's trying to tell you. Right? The next couple ones, right? Feel your feelings, right? So actually she references the book Permission to Feel, which again, I'm going to link that one here because I actually did a book review on that one as well. And I recommend, but generally, again, just really starting to shift your reactions to your feelings, really starting to get comfortable feeling your feelings and all the feelings, right? Not just the comfortable ones, but the uncomfortable ones. Notice any patterns, right? So notice any patterns that are showing up in your life and whether that's based on your upbringing, attachment, trauma, things like that. Again, so just really noticing any patterns that are showing up in your life so that you can start to see if there's areas of growth or movement there. Practicing gratitude, right? She talks about the importance of gratitude in a daily, potentially gratitude practice. Learning the difference between a true yes and a true no. So really kind of leaning into, and she even talks about like somatically knowing when someone asks you for help or an opportunity shows up, like really leaning in, is this a true yes? So is that something that it's calling to you, or is this a true no? And if it's a true no, then learning how to say no in a respectful and honorable way. She also talks about, for some people, the role of psychedelics. I'm not well versed in that, so I can't really comment on that. But if you are interested in that, she talks about it in the book. She kind of gives research on it, her experience personally, as well as with clients. So yes, there's new fields of research that's coming up and talking more about psychedelics. So I would encourage you, if that's something you're interested, just to read that section of the book. Promise if you stuck to the end of the video. So this month I'm doing something new. I'm actually doing a giveaway for 1 copy of the book. I'm going to try it out and see, because honestly, something that I've noticed, obviously I'm picking out books that I recommend, that I really enjoy, but my hope is that you actually pick up the book and read it. But in general, I'm going to start to really give off at least 1 book a month from the books that I'm recommending. So actually check out the comments below to really see the information, how you can enter, things like that. Again, 1 book, 1 giveaway. Lastly, I hope that this book, whether you get it as a giveaway or you pick it up, I do truly recommend it if you struggle with anxiety, or if you know someone that struggles with anxiety, pick it up as a gift, because I do think it'd be helpful. And lastly, I encourage you to continue nurturing your mind, body, and soul, whatever that looks like for you.